mtumishi wake Bwana, nitendewe ulivyonena.
Mpendwa muumini, tumsifu Yesu Kristu. Kila mwaka wanawake wa Katoliki kwenye jimbo kuu Katoliki la Nairobi hujumuika kama familia moja kwa minajili ya kukamilisha siku ya sherehe ya kupashwa habari ya kuzaliwa kwa Bwana tarehe 25 Machi. Sherehe hii itafanyika siku ya Jumamosi tarehe 23 Machi mwaka huu katika uwanja wa St. Mary's Msongari, eneo la Westlands kwenye jimbo kuu la Nairobi. Ibada ya misa itaongozwa na Askofu Mkuu Philip Anyolo wa jimbo kuu la Nairobi kuanzia saa 4 asubuhi. Kama ilivyo desturi yao kwenye misa hiyo, wanachama wapya wa kikundi cha CWA watapokelewa rasmi. Maadhimisho haya yatakufikia moja kwa moja kwenye runinga uipendayo ya Capuchin TV pamoja na mitandao yetu ya kijamii. Capuchin TV inawapongeza wanawake wote wa CWA kwenye jimbo kuu Katoliki la Nairobi katika maadhimisho haya. Endelea kutazama Capuchin TV, kitambulisho Katoliki.
Mimi ni mtumishi wake Bwana, nitendewe ulivyonena. Mimi ni mtumishi wake Bwana, nitendewe
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
A very good morning to you, dear viewer. Thank you for joining us yet again on another episode of Health Corner Show right here on Capuchin TV with me, Maureen Kimani, a program brought to you by Capuchin TV in collaboration with St. Mary's Mission Hospital, where we bring you conversation concerning your health, lifestyle, mental health, and so many other topics. And today we have a very interesting conversation with you, and that is bonds, that is understanding bonds, as you can see down below on your screen. And I want to say that whether it's a kitchen mishap, a workplace accident, or a brush with fire, bonds can happen to anyone, anytime, at any place. And so that's why we bring you this conversation to help you understand more on how you can learn to protect yourself and your loved ones. And of course, joining me right now in the studio, we have a guest from St. Mary's Mission Hospital. He will be introducing himself in just a few. And in case you'd love to share your thoughts with us, your experience on bonds, in case you have a story, you can do that on 0717-424-866, or you can use our SMS number, that is 21760. Welcome to the conversation. Hi, Mr. Rogers.
Hi, Maureen.
Good morning. Good to see you.
Pleasure to be here again. My name is Rogers Kiplimo. I'm a nurse at St. Mary's Mission Hospital. I'm working in a surgical unit. At the moment, I'm in theater. So, pleasure to be here again. Yeah.
It's good to have you for the second time now.
Thank you so much.
Yeah, and actually, let's talk about your names. You have two phenomenal names that are associated with good people in the society. That is Rogers and Diego. You didn't mention about.
Yeah,
about
exactly.
that.
Exactly.
Yeah, so thank you for making time. Well, when you talk about understanding bonds, what does it mean to you as a professional in a medical expertise area?
Thank you so much. When we talk about the bonds, it's one of the largest area, but I'm very sure many people have been encountering this thing all through their life. Many people have developed bonds on their daily activities. So burns is just in simple way is an injury to the skin that normally that is being caused by maybe the heat, maybe the chemicals, or maybe you have developed a friction along the hard surface that can injure your skin. Yeah.
Okay, and so many people think the sunburn part is part of the burns. What do you have to comment about that?
Yeah, it is, because the degree of the exposure of the skin exposure to the areas, because some of the areas experience different degrees of heat or the sunburn. So more so, you realize that in coastal areas, some people can expose themselves to high heat in terms of sun rays. So later on, you realize you are developing some scales, which is one of the signs of burns. Yeah, but it is in minimal way. It's not a bigger part of it in a way that we can categorize as a bigger side of the burn. Yeah.
Okay, and what's your story? Have you ever experienced a burn in your life?
Yes, I have, but it was something I think at when I was 14 years old. I had to touch a metal, which was it was very hot. So you realize that at home, you are making these the metals that being used for maybe our normal activities at home. So it was hot. It was supposed to be made for when we are doing fencing, there is a way that you can drill the hole before you put a post. So I had to touch it. So I had a like second-degree burn. So it was a very bad experience, actually.
Okay.
But we managed to control it. Yeah.
And now you're okay.
I'm very much okay.
All right. You know, when you're at that age, you're very curious in so many things.
Exactly.
So probably maybe that's what happened.
Yeah.
When you talk about understanding burns, what are some of the types of the burns, and what are some of the causes?
So for you to understand mostly about the burns, you realize that you need to know how our skin is being arranged, the way God did it perfectly. So in terms of to preview through how the skin layers look like. So the skin is arranged in 3 layers. We normally have the upper, the center, and the lower part. So the upper part is called epidermis, whereby it is just, we call it a dead tissue part, but it contains nerves. Because the moment you have touched something, you feel pain, because the nerves are all on the upper part of the skin. Then the second layer is the dermis. The second layer is whereby you will find there are blood vessels, there are again nerves, there are some fats, there are some oil parts that produce oil to make the skin shiny. The lower part is the part that contains, it's called subcutaneous layer, whereby in this layer, it has adipose tissues. Adipose tissues are the fats, and the fats play the role of protection. It is protecting the muscles, it is protecting the bones. So you realize that when we categorize the burns, it is based on how the heat or the chemical have damaged the entire skin. So you realize when you had a burn, it can burn the upper part, which we call superficial burns. It is very painful, actually, because of the nerve distributing on the upper part of the skin. When that's a first degree burn. The second degree is it has already damaged the first part, that is the epidermis. I've already communicated to the dermis, and now it has exposed the blood vessels and the nerve. So it might bleed. It is very painful again. So it is the second degree. When you go to the third degree burn, it has already gone deeply to the subcutaneous. The fats are exposed all through. You realize that bleeding is there, pain is there. But on the fourth degree, you realize that it goes to the bones, and that is, there's minimal pain because we have already damaged the nerve. So there's minimal pain in that. So when you are categorizing the burns, you categorize based on those layers of the skin. And the cause depends. It can be you are being maybe the heat, it can be the chemicals, it can be so many things that can cause that damage of the skin.
Okay.
Yeah.
All right, and talking about this conversation, I remember some few months ago, I think in the month of January, our country was in a low moment, that is in Embakasi, where there was an explosion, and more than 100 people got to, have these bans. What are some of the steps that one should do immediately one experiences this scenario?
In a scenario like that, sorry to say that it was a very tragic thing actually.
Sure.
And when it comes to issue like that, you realize that the flame is there, and you consider first of all your safety. Before approach first, you consider how safe is the environment, because you might enter there and be part of the people that will be affected. So you realize that one of the key factor here is this: you are supposed to put off the fire. That is the first thing. After putting off the fire, you now identify, because it's a tragic thing actually, it's very bad. And after putting off the fire, you do what we call isolating, how the degree of the burn have already affected the people. If there are those who are still, when we are categorizing burns, we normally do what we call the rule of 9. The rule of 9 is normally applied in an hospital, like in our setup. So when you do rule of 9, we are doing what we call the surface area calculation of the damaged part of the body. So when to brush through, we realize that our head comprises of 9%. Our trunk is just 18% back and front. The lower part is 18% to make a total of 100%. So when you isolate these people, do as per the degree of the burn. You realize that those who have involved the burning of the face, there is a risk of developing burns to the internal part. So we rush make a communication. If you have the number for the ambulance, if there is a nearby facility, take the patient for the first aid management. If there are those who are still having clothes and there is still burning, you advise them to stop, then to halale chini alafu roll. So that is the moment you are putting off the fire.
Okay.
You are getting? So we are doing what we call coding of the people. There are those red coding, yellow, and all sort of, we do coding in hospital. So before coming to the hospital, if there is nearby, there is water, run them, let the water run over the burn area so that we are relieving the pain. After now, you have identified people, knowing that these are the mostly affected people. Number 2, these are the ones they know. If you ask someone by the name and they introduce themselves, you identify which site. If it is a smaller part, run over the tap water. It can relieve the pain.
Okay.
Those are the things now you are supposed to understand. So we prioritize before reaching now the facility. And I'm very happy when in Kenya we have the ambulance, in our facility we have it, so they respond fast. So we now manage in terms of mobility and casualty services. It is being offered perfectly.
Okay.
Yeah.
All right. And it's very interesting when you take a look in how we were brought up in our homes or in our society, and you find that in every home there must be that person who is a doctor.
Yeah, exactly.
When
Very
you
true.
experience such kind of thing, or maybe just a hot water spills on you, they give you some instruction. Maybe you're supposed to put a toothpaste. You know, it's gonna relieve the pain. What do you have to say that? Because I think most of the people, that's the first precaution they take after they experience themselves. The action they take after the experience in such kind of activity, or maybe a bad scenario.
So you see, in African culture, we have many sorts of managing some things actually. We have remedies. Others will tell you, like you have said, you are putting a toothpaste on it, and it will, actually it can heal, because depending which the state of the affected part, is it as I've said earlier, is it first, second, or third degree? So when the body will react, there is what we call inflammation processes. pain is there. So when you had maybe now as a toothpaste, what you have said is just you're adding another layer to make sure that you are controlling only infection. But at the same time, the remedies that is in paste is not good for the healing. So the best way of doing the issue of sorting when you see the burn is that you are not supposed to add anything. Okay, if there is a blister in formation, don't break the blister. Leave it the same until you come to the facility, because it is a dead tissue, so we are supposed to remove it. But when you remove it at home, you are at higher risk of infection. You are exposing, because the upper part of the skin is a barrier against microorganisms that is surrounding us. So when you break the skin, or already the skin is exposed, and you add now the toothpaste, what are you doing? Do you know the remedies that is containing the toothpaste? It is meant for the for brushing our teeth, but not for the wound healing. So I could advise, when don't take any burn as one of the as a assuming thing. You just come to the facility, let you be seen. The doctor will do what we call it total service area burn. Then you are being given now the way forward. If it is a smaller thing that you can manage at home, the doctor is the best advisor for the management of the burn. But home remedies, I don't advise. The only remedy I will advise is just running water if it is painful, but not ice. Yes, running water, cool, not ice, because the moment you're adding ice is the moment you are damaging your entire body.
Okay, all right. Thank you very much, Mr. Rogers, for that beautiful insight and clarification. And I hope our viewers are being able to learn all these conversation and what they're supposed to do in case they find themselves in this scenario. Okay, when we talk about these burns, how often or how long does a burn take to heal?
It doesn't, when it comes to burns, it doesn't have specific time. What dictates everything is how deep is the burn. The moment you realize that it is more deeper, it takes more time to heal, because the tissues that were already there is already damaged. So the body will try to compensate, to rearrange some tissues again to heal that area. Another thing is your age. For the elderly people, it is slow healing compared with the young. The young, the tissues are growing faster. But for the elderly, you realize that now it takes slow to heal. You're getting me?
Yeah.
So when that applies, you realize that for the elderly one, you go like 6 months and above. And for the young one, you realize in the next 1 month, 3 months, and the diet dictates now what you take dictates what is the results of healing.
Okay.
Yeah.
All right. And you've mentioned about some of the risks that can associate with these burns if they're not treated properly or even very fast. That is, you mentioned about infection. What are some other risks that are associated for not treating these burns in a minimum time that can, happen?
Some of the risk factors that normally happen when you develop a burn is, number one, you are being psychologically tortured, because for ladies, beauty lies on the face. So you realize when someone now have had a burn on the face, how will you feel? Now the healing process has taken place, but your normal face or the skin color will not be the same way it was before. So it is psychologically torture, because the moment you see yourself in a mirror, what comes to your mind? You are not the one you are. Maybe you have some pictures in your wall, so when you try to compare, so you are tortured psychologically.
Okay.
Number two is that when you develop a burn and you assume maybe you have not gone to a facility, we develop some complications like contractures. The healing, it can heal, but the normal anatomy or the normal way that your hand was. When it heals and you have not gone for a physiotherapy, it can heal and form a contracture that you cannot perform your normal activities as you used to do before. Okay? Another thing is there is prolonged, the time of healing is prolonged. Because the moment, the deeper the wound, the time is longer. You're getting it, eh?
Yeah.
So when that happens now, you realize that there is longer healing, infection recurrence that is coming again. So you are developing the risk, your system is at risk of having those infections because the entry of microorganisms is through the opening that you have already had in your body. But when you do maybe the follow-up, the medication well, healing process will take place and you will be at a lower risk of those what I've mentioned.
Okay.
Yeah.
All right. And at St. Mary's Mission Hospital, how do you deal or how do you cope with these clients or patients that come into the hospital and they have experienced the bans? Because I know the society can have a pressure on you, as you talked about, especially for the ladies, in case your face just get burned. Now your beauty, you feel you're not pretty anymore. How do you have a counseling to maybe walk through these patient to ensure that they don't feel, okay, anyone can get a burn, as we talked about that in the first introduction part. Do you counsel the people just to help them to accept their situation and of course give them a hope message to ensure that they may get better later on?
Yeah, in St. Mary's, you normally realize that when we have the patient who have had burns. So the thing is that when that person is being shifted from home to a facility, we don't only do medical treatment of the patient or wound treatment of the patient. Counseling again, in presence, a doctor can come and have a conversation with you. And when you see other patients having burns, you realize that even for yourself, you can say, okay, so it means now it's not only me who is being affected, we are many. So you realize the counselor unit, we have counseling unit in St. Mary, so the counselor is normally visiting those clients or those patients with the same problem and offer services of counseling. And you realize when they are being discharged home, they are happy to see that they are again, they are being considered as one of the people that we give the perfect observations. Yeah.
All right. I thank you very much, Mr. Rogers, for that beautiful and valuable insight about understanding burns. And with that, we're going to take a very short break. But when we come back, we shall continue with a conversation that is understanding burns. And of course, you mentioned something to do with the diet. So you can maybe talk about what are some of the diet or nutrition one is supposed to observe when you have these burns. And so stay tuned for that. And in case you'd love to ask us any question about the burns, you can still do that, and we will be able to get back to you in just a few. Stay tuned for that. We're taking a very short break. Don't go far.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. Feeling unwell? Seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic healthcare. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity.
We have labor and delivery. We also have postnatal care, and also we deal with mothers who've come that are sick and are there in the antenatal period. That is antenatal care. Generally, we admit every mother who walks in labor and any mother who comes from the clinic for monitoring of labor and also delivery services. And also in maternity, we have a theater whereby all mothers who are not delivering normal are usually taken to theater for cesarean section.
Ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
Specialist clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at info@stmarysmissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare. Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Welcome back, dear viewer, to our conversation right here on our Health Corner show with me, Maureen Kimani, on Capuchin TV, a program brought to you by Capuchin TV in collaboration with St. Mary's Mission Hospital. And in the studio, I'm being joined by Mr. Rogers Kiplimo Yego, who is a nurse at St. Mary's Mission Hospital. And in our first part, we've been able to understand more what is a ban, or what are some of the types that do we have. And continuing with the conversation, we shall continue talking about on the treatment part and how people can take precaution and take care of themselves and their loved one. And in case you experience yourself in this ban, how do you ensure that you visit the next facility, and that is, of course, St. Mary's Mission Hospital, have all the services, as Rogers mentioned about the ambulance, you can be taken care of. So you just need to dial their number, and the nurses and the doctors will be able to take care of you. So welcome back. And in case you still have any question to us, you can, or comment you'd love to share with us, you can do that on 0717-424-866, or you can use our SMS number, that is 21760. Welcome back to the discussion. Welcome back, Mr. Rogers.
Thank you.
Yeah, as we continue, I don't know if you have something to add before we begin with the conversation. Do you have a comment you'd love to share for maybe for a viewer who just joined us right now for the conversation?
Thank you so much. I think if the viewers, for the sake of the viewers and the listeners, I would like to say, if they have any concern or any question concerning the bans or anything, they are free to ask, because health is always wealth. So yeah, exactly.
And actually we say hashtag on our program, your health is your wealth.
Exactly.
Okay, let's continue the conversation. Are there any long-term consequences of severe bans?
Yes, it is. There is a long-term consequences of severe bans, and the long-term consequences is, one, the recurrence of the infections. And another thing is the contractures. As I've said earlier, those are the things that normally, those are the complications. Number three is about the financial constraints in your side of treatment. So you realize that a doctor or a surgeon can advise for some surgeries or some grafting or substituting the skin, and some of the clients can't assume not to consider the advice of the doctor, so they ended up going back home, not coming back again. So later on, when they come back, it has already complicated a lot. So you again start reconstructing the skin, as compared if you were to act early. So you see, those are the things that normally challenge in terms of consequences of the skin management. Yeah.
All right. And actually, Mr. Rogers, I'd love you to talk about on what ways that these bans can one be able to, get. For example, when you're ironing your clothes, the iron may fall down, and or you may sit on it. Sometimes you leave the switch on and forget that you left it on, and you just come and lay in your bed, and oh, boom, there you are. And sometimes maybe your spouse or your friend in the house might leave the gas on, and the consequences of leaving such kind of open stuff, the gas and hot stuff around, and you don't let your other person, maybe you're living in the house, know. What do you have to comment about? Because I think so many people experience only that it's a minor, not a major thing, like the Embakasi one.
I think the key area of concern here is the safety management, and understand your surrounding. To avoid these complications of having bans or having strategies like this. You realize that safety is one of the paramount thing. When you are in kitchen, do you normally assess what are some of the things that are highly flammable that are there? When boiling water, are you boiling on top of the microwave, or your microwave is down? You see, those are the things, and learn to handle those hot boiling water. How do you normally handle? Are you using this metal that they normally use to catch on the sufuria, what we call it? So how are you? Is it sometimes it is not providing enough when handling it? You realize that at the moment you are taking from one place to another. What if it fall? Definitely you will have a ban. So avoid those things that normally you assume that I'll take much or less time to work on this. So ensure your working environment is well arranged. you understand, isolate those things that are highly explosive or highly flammable from the things that are not. Number two is those chemicals. There are those chemicals that normally the manufacturer gives instructions. When you overuse it, there's a higher risk of this. So most of the people, in fact, I'm very sure, even some will not read even the jelly they normally use to apply on their bodies. Have you ever take time and read the manufacturer's instructions?
I do myself.
You do for yourself, but some for men we don't read.
Ladies, you're very sensitive. You need to know what are you using here.
So you, when you combine that, those when you combine can bring more damage to your skin and later on to be a burn again. Another safety measure is in your area, are there kids? Are there, because the kids between the age of 5 and 10, they are very active in terms of handling everything. So you make sure whenever you are going maybe for your workplace, ensure it is locked or there is someone who is there to handle those things. Another issue is your area, like I can pose a question to you. Do you have a fire extinguisher in your area, in your room or in your own place?
Maybe the surrounding.
So you see, you need to have those in case the fire break up or break out. What do you normally use to close there to put off the fire? Are there fire extinguishers? Are you having the knowledge of how to handle the fire, even in case it happened? How do you handle it? So you need to have those cautions or those safety measures be in place for you to ensure I'm prepared, because it is something that happens suddenly. Do you know, even in case it has already happened, what is the first aid management that I will offer? Okay, and if because you realize it is good that we are in Nairobi to access facilities easier.
Sure.
What of those people who are in far places that for them to reach a healthcare facility, it is mile away from the home state? How do you now a first aid management that you offer to the kid before reaching the facility or an adult? Okay, so it is better to have even a first aid kit. It is not expensive. So those are the things that we are supposed to know, have the precautions in it, have the safety measures in place, and have the knowledge on how to approach these issues of burns.
All right, and that's what you're doing right here at Capuchin TV to ensure that we create awareness and we pass this knowledge that you have and the experience that you have to our viewers, so that they may be able to learn and know how to live well. Well, when you move now to the treatment part, what are some of the treatments that are used, and are there any improved technologies to improve burn care?
You realize that all the way from the casualty area or all the way from the home place, I normally tell the mothers or the adults, you are the first doctor of yourself. I'm the second. So, and you need to have a backup of someone who will help you before reaching the facility. So you realize that after having that first aid management, once you reach the facility, we do that coding as per the way I mentioned earlier. So once you code the patient as per the deepness of the degree of the burns, we do now start management from there. It is a multidisciplinary approach. It is not a one-person management. It involves the entire, we have the plastic surgeon, we have the nurses, we have the nutritionist. So it is a wholesome approach whereby we do management. So the technology as of now, from there are so many research coming up on the management of the burns. Like when you go to some countries, they normally use the fish scales. The samaki, you remove the fish scales and then you apply on the side, and it works. And in terms of handling, again, we have to consider infection prevention. What is the implications to the person who have been affected? Because doing it, what is the outcome? Will you achieve the outcome? And in our area or in our facility, we normally do what we call negative pressure therapy. we do negative pressure therapy is one of the technologies that you normally, it fastens the healing process. The degree of the burn fastens you, it provides a vacuum. It is a vacuum negative pressure therapy. So whereby you seal the whole exposed area. So one of the advantages of this negative pressure therapy is that it promotes what we call granulation. It promotes what we call epithelialization. So when you enter the facility, the doctor or the surgeon will assess if there is what we call eschar. Eschar is the black formation on the skin that we are supposed to remove. So you remove it and you do what we call debridement. Once you expose the healthy tissues and there's enough bleeding that is evident that there's blood vessels and there's enough nutrition in terms of nourishment by the blood. So you realize the doctor will give advice, we proceed with the negative pressure. Okay. And that when you start the patient on negative pressure therapy, you realize that if it was to take like 6 months to heal, the negative pressure therapy will reduce to 1 month approach. So you see now we have shortened the lifetime of being in a facility and again being at a risk of some of the infections. So you see those are the things that is coming up every day. Number 2 is that in collaboration again with the nutritionist, there are some of the elements or some of the factors or some of the food supplement that have been done research that you take maybe 1 scoopful, it contains collagen, it contains vitamins that have already been measured. That when you take this twice a day, it again enhances fast process of tissue formation. So you see now as we proceed, I think by 2030 we will be in a position of applying the fish scales to our wounds. Okay. And it will heal perfectly.
All right. Yeah. Thank you very much. And I think you were able to talk about how long a burn can take to heal. And my question is, when can surgery be needed? Because I know sometimes there's some burns that need surgery. And I think you can tell us how much can it cost?
I can't estimate how much does it cost, but actually health is expensive in other words, but we need to adhere with. So you realize that the time that we need to do surgery is that the area that have been affected, because when you go to that degree burn of the wound, it takes time to heal. So the plastic surgeon will chip in here and give an advice on what to do. He can advise for skin graft. So the surgeon we identify some areas of your body that has not been affected. Then we remove the skin, apply on an area that has been affected deeply. You are getting it?
Like a grafting?
Yes, we are doing now grafting. That is the time now the degree of the burn determines the surgery. Okay? Some sensitive areas like the face, if it is deeply affected, we are supposed to return your skin back to the normal. So that is where the surgery will apply. Again, you realize again that maybe it is first degree burn or the second. When first and second, surgeon can do even that grafting. And that is the time now the patient will go for surgery. What dictates again that you are supposed to go for surgery is the age. And some of the comorbidities. You can have someone having cardiac issues. Can this patient qualify for surgery? So we outweigh the risks before considering patient to go for surgery.
All right.
Yes.
Okay.
Yeah.
And how can relatives, friends, and of course maybe the neighbors support someone who just maybe experienced these burns in their life?
I'll give an example. You realize that let me do an example for myself. Assume I'm sick right now and I'm being admitted in a facility. After being admitted in a facility, today I stay for 3 days without anyone coming to see me. But I have friends. Doesn't mean I don't have friends or I don't have family.
Sure.
I have them. But no one has come to visit me. What will trigger your mind?
They don't love you, something or so?
So definitely your psychological state is being disturbed, actually. And when your psychological state is being disturbed, the healing process again will be slower, because the body responds in a different way as per what you can. So the family gives a support in terms of healing. Where there is happiness, there is healing. Where there is spiritual, there is healing. So they give that moral support that for you are happy that despite being in this situation, there are those who can come and see me. Again, the family can't, some of the activities, they can take over the roles that you are doing before. Maybe you are the head of the family, but you have been affected in terms of this strategy or the problem of burns. A mother can take over as the head of the family. So they play a role of taking over some of those activities that we were doing before. Another issue is they give a conducive environment for you. And when there's like the way we are now, the environment is conducive for me and I can stay. So you see, that is the happiness of having the families coming to see the patient. It is not even necessary that you are even a family. I like the churches, the friends, not even friends, the spiritual way of approaching the patient, giving that moral support. Those are the things that give the patient that strength. Despite being in this thing, I can fight it and I will make it out of it. So you realize that the family, the community, and the entire friends or everyone play a very important role in terms of healing process. Yes.
All right, and actually that reminds me of one thing I was told by a friend. When you go to visit someone in the hospital, in the world, don't just say hello to your friend or relative, whomever it is. Just seek around and see who doesn't have a friend there, and go say hello to them. Just give them a word of hope. It won't cost you nothing.
No, the problem is me being an African, the problem is the culture. That once you go to a facility and once you're being admitted in an hospital setup, what comes to the mind is that, how is he looking? How does he anakaa aje? You see, those are the questions, because most of the people fear to go to a facility or the hospital. Have you ever taken your time and go to see the patient? Most of the people don't like, but it is very good because they are our people. And you don't know when will you find yourself there. Those who are there is not their willing. They find themselves being there, but
very true.
We are supposed as have that heart of being a human being and say, let me take this particular time and go see those who are not well. And even for them, seeing a stranger, offering maybe support, they will be happy and they will heal perfectly, actually.
All right.
And they will go remembering you that there's someone who came and see me, and I'm very happy for that.
Yeah, the act of charity. And actually, for the Catholics in this Lenten season, it's one of the things that we are advised to do as Christians. And well, allow me to read some few people who are following us. We have Teresia Njeri, a nativity of the Lord Kagwe Parish. Thank you, Teresia. We have Teresa Kemunto. She's in Moranga. And we have Fifi Emush following. Thank you, Fifi. We have John Mugwe. Nice discussion. Thanks, Capuchin TV and St. Mary's Mission Hospital.
Thank you so much.
Thank you very much for your comment. And let's talk about how can people avoid getting these burns in lifetime? How can they, take precaution?
Some of the precautions that you normally take to avoid having these issue of bans. Like I can use an example of what happened the past 2 months. That in terms of the government should ensure that there are somehow the place people settlement areas is not near the settlement area should be far from industrial areas. Some of the things that are highly flammable should be kept away from the settlement areas. Another issue is coming back to the home state. Is that you normally have to separate between your area of high risk and safe area for the family. Again, teach everyone at home safety measures to take, some of the precautions at a younger age. I like our mothers used to give us cautions. Leave this thing, it will give you up. But for the children, they normally go for it. So people should be taught how the risk factors of this, like gas at home, to take some of the precautions, not to handle carelessly. And if you do that, you realize that the safety paramount, the fire extinguishers, the education to play a key role to ensure everyone at home understand the risks of these things. Another issue is about when you give an education on someone, you can have maybe an example of having these fire extinguishers, but I don't know how to use it. You see, so let us not put it there for the sake of being a flower, but let everyone know how to use it and to check. You can take time and do even demonstration of how to use it. So those are the things that we are supposed to ensure that everyone have to have it in their fingertips on proper approach for every person who have been affected and before.
All right.
So we need to know after and before.
Okay.
Yeah.
All right. Thank you all very much. And as we come to the end of our session today, what is a parting shot, and maybe for the person who is watching us here at Capuchin TV would love to come and make a visit at St. Mary's Mission Hospital, how can they do that?
Thank you so much, Maureen. We in St. Mary's Mission Hospital, as you have heard, is a facility that offers perfect management in terms of patient approach, patient care, and giving a proper care to our patient. So the only thing I will advise them is that you can just take time, make a visit. It's not about that you come there when you are sick. Just know the place, understand the flow of the place, the layout, and interact with our doctors. They are very friendly people. Our nurses, our nutritionists, everyone is friendly there. So they are free to come, interact with anyone, and free to consult anything they want, and they will be helped so much.
All right. Thank you very much. And what do you all want to emphasize about understanding bans?
The only thing I will need to emphasize is the first aid management, because I've said earlier that one of the key important thing here is approach. How do you approach it has happened? Before you bring a person at home to the facility, know the time that the patient had a ban. Know the time, because the moment you understand it happened at exactly 9, and the degree of ban when the doctor assesses is the time now we start what we call fluid resuscitation. When you are doing resuscitation, is the moment your skin is exposed, is the moment you are starting to lose more fluids. And when you lose more fluids, is the time now your body organs is at risk of collapsing. So when you rush, know the time, the scene, or the time that the fire breakout started. Number two, don't assume the severity of the burn. The moment you are assuming is the moment you are at risk of having the conditions prolonged in terms of healing and infection.
Okay.
So let them understand the time that the scene of burn started. Give the right history of what happened, not to hide, and they will receive the right management for the patient.
All right. Thank you very much for that insight and for making time here at Capuchin TV. We say thank you to the St. Mary's Mission Hospital for always ensuring that our viewers get the right health information. And mine is to say that we hope that you have gained valuable insights into prevention, treatment, and management of burns. And take care of yourself and your loved ones. We can reduce the risk of burns and ensure swift and effective care when they occur. Thank you very much for tuned in to our conversation today, and saying thank you to the Capuchin TV crew that has been behind the scene. We have Alan Andiva, Kelvin Kitavi, we have Henry, we have Willie, and Peter Mwangi. May God bless you. My name is Maureen Kimani. See you next time.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. Feeling unwell? Seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic health care. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning, and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity.
We have labor and delivery. We also have postnatal care, and also we deal with mothers who've come that are sick and are there in the antenatal periods. That is antenatal care. Generally, we admit every mother who walks in labor and any mother who comes from the clinic for monitoring of labor and also delivery services. And also in maternity, we have a theater whereby all mothers who are not delivering normal are usually taken to theater for cesarean section.
Ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
specialist clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at info@stmary'smissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare.